This is The Gum Guru with Dr. Macon Singletary from North Raleigh Periodontics. This is a show about keeping your teeth and gums healthy and how a healthy smile affects your overall health. Today's episode is called Golf Bag of Treatment Options, How Periodontal Disease is Treated.
Welcome to the Gum Guru podcast with Dr. Macon Singletary from North Raleigh Periodontics. I'm Jason Kong here with Dr. Singletary, and as you heard, we're going to be talking about the golf bag of treatment options when it comes to treating periodontal disease. All right, Dr. Singletary, the golf bag of treatment options, is this a hint to us that, you know, you're this amazing golfer and you want to find a way to weave the subject of golf in throughout the show today?
Actually, just the opposite, Jason. When I was in dental school, I went to Emory in Atlanta, and the first day of class, I was sort of a stranger to Atlanta because I went from Durham to Atlanta, so it's going from small town to big town.
Yep.
And as I was putting my equipment in the locker, one of the senior dental students said, "Macon, come on, let's go play some golf." And I said, "I don't play golf." And he said, "Boy, you ain't going to graduate." And there is something to that because that's how you socialize. But I like the analogy of a golf bag of treatment. When I swing, the ball moves right or left. It develops legs, and it's just ridiculous. Or either I whiff it. But the analogy of a full bag of options is what I like to use for my patients.
Yeah, I think that helps give a visual. So let's get into that so that periodontal disease isn't just, well, this is how we fix it, this is the one way we do it, and that's it for everyone. So this is clearly not like that.
Right, exactly. So what happens when we do an exam, there are three things I'll blend. I blend the medical history with my oral exam, and the oral exam is pretty extensive. I'm looking at the depths between the tooth and the gum, and I don't do this to see how far a person jumps out of the chair. I take my little probe and measure the pockets. I call it my medieval torture device, but I tell the patient, raise your left hand if that's uncomfortable. And then the way the teeth fit together. So, I mean, it's pretty extensive evaluating the oral cavity, the way the teeth fit, the musculature, the pockets, under the tongue, and then the x-rays. And with those three things, I'll come up with a diagnosis, prognosis, and a treatment plan. So that treatment plan can vary from person to person. Another visual that I use, I call it the pyramid of susceptibility. At the top of the pyramid is what causes gum disease, bacteria. Inside that pyramid are two things you have no control over, your immune system and the makeup of the saliva. Everybody has some form of gum disease in their life. If you have a big pyramid, low threshold, it doesn't take a lot of bacteria to be, I can look in and see no plaque and they're losing teeth. Some people have tons of plaque and calculus and they still got their teeth. They got a small pyramid. So what I recommend and what I do really depends on what I see. I call it the snapshot, what the movie picture is going to look like. I can't predict that, but I can get an idea. And it's important. The medical history is key. I mean, medication you take, people, they're taking things for allergies or autoimmune issues. It affects salivary flow, affects the immune system. Other things inside the pyramid that you don't inherit, like smoking, stress, all affect how a patient looks at that first appointment. And what I recommend really depends on that aspect of my evaluation, and it varies from person to person.
I think that's comforting in knowing that there's such a comprehensive approach here because you're factoring in the entire medical history and overall health. It's as we said, this isn't just, I've got my one golf club and I'm going to use this to fix it. It is using the best tool that is available to you for the right situation, a customized approach that factors in the patient. And to me, that's comforting knowing that I'm being treated in a way that's best for me and that will provide the best health outcome for me.
Exactly. And everybody's different. The most important thing to understand, no matter what I do, because you can go to my general dentist friends and they'll do a filling and you're done. They'll do a crown and you're done. You see a periodontist or see me, unless you fire me, I'm there all the time. I'm the right arm of the dentist because I don't do restorations, but you want the foundation to be good, but once I do something, the bacteria grows back. So some people say, well, I'll just take all my teeth out. No, you don't want to do that either. It's simple, really simple. The most important thing is understanding that you can physically remove it, and what you do at home is key 4 times a day, and floss one of those times, preferably before you go to bed, and stay on a good cleaning program. We call them infection control therapy in our office. And that's one of the clubs, but the infection control therapy, it's an ongoing issue. You can't just do it once and you're done. And I've been doing this a while. So in my mind, I know for a patient, for whatever medication they take, whatever medical history they present, what the x-rays show me, I have an idea what would work best for them. And we're quick sometimes to make a diagnosis and a treatment right off the bat. You really can't do that in periodontal therapy. It takes a while to see how a patient heals and what club I use and how they respond to that club.
Going back to the home care part of it, how much of this golf bag is just your golf bag, and how much of it is also the golf bag of the patient as well? Do they have to work together? Can it only be you? I mean, how does that work?
That's a good question, because I call it audience participation. I mean, I can do my thing. I call the antibiotic club a putter. You can get around the course with a putter, but not very effectively. My 5-iron is the deep scale and root planing club, non-surgical therapy. We numb you up, and you can drive in, drive out, and that's sort of the standard. There are limitations to these clubs. You do the antibiotic club, they kill it for 6 to 8 weeks, and they grow back. You do the root planing club, there's a limitation between the tooth and the gum. If it's deeper than 5 millimeters, we may not be able to get all the etiology or calculus off the root of the tooth. The laser club is Big Bertha. I guess they still have Big Bertha. I don't play golf, but and I have all sorts. I mean, that's part of our technology. But the most important thing is, and you brought up a good point. I'm gonna have to add another club. Maybe it's the wedge. That's the brushing and flossing club that they have to do consistently every day. A person comes in, they don't walk through my front door not wanting to save their teeth. They're either coming in for a second opinion, which we do all the time, and that's a good thing to do, because we do a detailed exam, and I can give patients some options. But sometimes they don't come. They come in. They want to save their teeth. That's why they get through the front door, and then they sit down, and I say, okay, this is what you need to think about, and I'll ask, how many times a day do you brush your teeth? 99% of my patients, even patients who've been with me a long time, will say once or twice a day, and I'm shaking my head. I said, that's not enough. That's a club that they need to do themselves every day. It's like taking a shower or eating. I mean, I think it's sort of the last thing we do, because normally we're not hurting in the mouth. If it starts to hurt, we do something. Well, that's like high blood pressure and glaucoma. It's curtains. It's too late. You don't want it to hurt. And so the club of oral hygiene is key no matter what we do. And when a person invests in their mouth, I try to look at, are they going to get bang for the bucks? Based upon them, I'm not judgmental, don't get me wrong. I have patients that come in, if they're 30 years of age and they got advanced periodontal disease, what I'm going to recommend may be different for them than a 80-year-old patient that comes in and has the same thing. Prognosis in the 80-year-old may be better. There are a lot of things that go into that. And that may be another podcast about, what treatment do we actually do and for people and why. But in that golf bag, it really depends. Age is a factor. Do they smoke? And so when I reach into my club, I try to pull something out that I think, first of all, will benefit them. Initially, if we do the root planing club, I'll get them back for an evaluation. I call it a treatment analytic appointment. And I'm blending 3 things at that time. I'm blending what they're doing at home, how they're physically removing the bacteria, what we did, and how they healed from what we did. And then I'll say, okay, you need to get your teeth cleaned so often. And we'll, if there's a referring dentist on board, we'll communicate with them and try to orchestrate that maintenance program. And we try to stay on top of it. I mean, we all have lives and miss an appointment, but we try to track it for the patient as well for the dentist that I'm working with if they come from another dentist. We try to stay on top of it for them. That's the reason why in our practice, national studies show that anything that we do, we see a 5 to 7 year improvement if they're on board doing what we say do. In our practice, it's 7 to 10 years. The difference is we're on top of that. We help the patient. You missed your appointment today, Ms. Jones. We'll be glad to reschedule you. In a national study, they're usually done at universities. They just say, adios. You're out of the program, the test. So it's a little bit different. We care about our patients. What I do for them, what club I use, really depends on the person. You really can't cookbook it.
Yeah, and it's that personal touch that it also plays into, of course, what's best for the patient, but what are they going to be most comfortable with, and what can they achieve going forward. And speaking of that, it's important after you make that first step to go see you, and then you have your treatment regimen after that. Why is it so hard to take that first step? Sometimes, we may find out that there's an issue, that periodontal disease could be a threat, but sometimes we may just put off scheduling that appointment or getting that second opinion. How can we overcome that?
The major one is apprehension and fear of the dentist, what we do. And, I'm the biggest dental phobic on the planet Earth. And, I think I told you I went to the dentist one time when I was 8, and the next time I'm in the dental chair, I'm in dental school. So I understand that fear, but it's a matter of it's priority. Sometimes, like I said, when somebody's not hurting, there are other things that they're focusing on. But it's unfortunate because periodontal disease affects systemic health, dementia, cardiovascular issues, diabetes, rheumatoid arthritis. Those bacteria that grow in the mouth get in the bloodstream, and we now know with technology today that there are systemic effects of these periodontal pathogens. And so it's education, podcasts like this where we're educating the public, because it's tough for even general dentists to communicate exactly what's going on. The technology, every day there's a new article out, and the American Dental Association says tell your patients to brush their teeth twice a day, and I'm shaking my head. No, you need to do more than that. You got to be more consistent. It's simple to control gum disease by physically removing it yourself. It's just a matter of wanting to do it.
Yeah, and I think when you juxtapose that with the potential harmful effects on your body that periodontal disease is linked to, as you mentioned earlier, that's the scary part to me, and that's the part that would make me really want you to dig into your golf bag and make sure that you're going about the best route for me, because the threats that those pose, that's no joke. You're talking about taking years off your life potentially if this is not treated.
Exactly. And so, I'm a visual person. When you come in our office, I'm going to take a sample of your bacteria plaque and put it under my microscope and put it up on the screen. And when you start, all of a sudden you realize that's in my mouth, that's growing in my mouth. Every one of my patients, that when we start doing this, this is what I used to do when I started my practice years ago, and then for some reason I stopped doing it, and now I picked it back up doing it again. And what I've found that I think patients are interested in learning more about me, and they'll Google, they'll go online and see what periodontal disease is. They'll try to figure it out. But once you show somebody, I've been real impressed how it's changing their approach to what they do at home, because obviously when you see a modal rod scooting around on your screen up there, and that's what causes, that's Prophomonas gingivalis, that causes rheumatoid arthritis. Or this one's a spirochete, little squiggly little thing, that's Treponema denticola. Fancy names, but they found in the brain producing a protein affecting neurotransmission, dementia. People generally get on board. My patients that smoke, I tell them nicotine is not good, affects inflammation. That's in that medical history that can affect what club I pull out. If somebody wants to do implants and they smoke, not a good idea, because it affects bone metabolism and affects the long-term prognosis of maintaining an implant. And if I tell a patient, you need to stop smoking, and they look at me, well, I'm not going to do that, I'm going to say, well, it's going to limit, really, you got to be aware of what you're investing. If you're going to invest in nice appliance and implants and bridges, you really want to stop smoking. Plus, it causes lung cancer, which is even more of a threat, I think.
And I think that's an important approach for the patient, because I think so many times when we go to the dentist, we might find out on this occasion I'm seeing a lot more plaque or tartar or bacteria or whatever it is, and cut out whatever this is in your diet, or maybe reduce this or work better on brushing, as opposed to what you're doing. And you're explaining, well, this is what's going on in your mouth. And, I think I would appreciate that more, understanding, okay, this is what's happening. This is the threat that it poses, as opposed to, hey, just do a better job brushing.
Mm-hmm.
It's not just, you're not just telling me what to do, you're telling me what's happening. Mm-hmm. And I think that gets me on board with the treatment plan.
Mm-hmm. Like I say, sometimes I get second opinions, and it doesn't necessarily mean they'll continue, but I'll say, this is the path you ought to go, this is what you need to realize, to be aware of. When I'm reaching that club and pull something out, I want to make sure that whatever I do, whatever I use is going to help that patient long term. Some of those clubs are diagnostic tools like the DNA analysis. Rather than the microscopic view, we can take a sample of their plaque and do a DNA analysis and see exactly what's growing in their mouth. Some people want to know, how, particularly if they don't respond to treatment, that treatment analytic appointment where we analyze whatever we've done and see if they responded. If they don't respond the way we want, we'll do a DNA analysis. So there are things that we can do before we jump on board with an extensive treatment plan or restorative therapy that involves a lot of money that I'm thinking, okay, we got to see what we got going on here before we go to the next step. But showing the patient helps.
I could definitely see how that is the case. Is there anything else we need to know about the golf bag of treatment options?
Well, it varies. It depends on what we see. So, each person's different. And some have limited options for whatever reason, and some have a full bag. But the main thing is just to be aware of what they have, and then what we can do, and then what would be the ramifications if they don't do anything. COVID wreaked havoc on a lot of people. They were stable, doing the things that we sort of said. The two most important things: what you do at home, and your maintenance. And the ICTs or regular cleanings are key part wherever they have it done. If they can just stay, that's the two most inexpensive things that we can do for a patient, or what they do at home and regular cleanings. And if that's all they do, they're going to slow things down. No matter where they go, whoever does it, it's going to help them. It's just a matter of realizing, okay, am I susceptible? What's the next step? There are things that they can do at home in addition to, if you want to talk about action steps, they can get disclosing tablets. They can go to Amazon and order dye disclosing tablets that stain bacteria on the teeth. Anything red on teeth is bacteria. Simple thing to do. If some people they don't feel it, they don't see it, they brush and they think they got everything. You take one of those tablets and chew it up and swish it around. Be careful because it stains everything. When they spit in the sink, but anything red on teeth is bacteria. And then brush it off. That's a real simple thing to do so they can evaluate themselves at home.
That's a wonderful action step that we can all take, and something that we may be surprised to see. And, making sure that we're getting our regular checkups and making sure that we're brushing 4 times a day and flossing 1 time a day, that really goes a long way. But that's an interesting action step that I think we all should take, because there's certainly no downside to it, but I think a lot of people would be surprised at some of the results.
Yeah.
That'll do it for us today. Thank you so much for listening to the Gum Guru podcast. Be sure to check out our next episode.
If you want to know more about the ways to make sure your smile is healthy and more information on whether you need to schedule an appointment with Dr. Singletary, check out their website at NorthRaleighPerio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@NorthRaleighPerio.com.